So today I'll be presenting some information from the DOPPS Practice Monitor related to the CMS Dialysis Facility Compare star rating system. The star rating system is comprised of 9 measures. The first 3 are the standardized mortality, hospitalization, and transfusion ratio. The next 4 are related to hypercalcemia and dialysis adequacy measures, and the last 2 are related to vascular access. The color scheme on this slide is as follows. The measures in brown are derived from Medicare claims data. The data that we're going to show today are derived from Medicare claims data. The items in blue are presented using DPM data, using methods that are similar but not quite exactly the same as those used on the star rating system. And the measures in green are available through our broader DOPPS program of studies. In particular, the peritoneal dialysis adequacy measure is available through our PDOPPS, or peritoneal DOPPS study, and will not be presented today. So this first slide is demonstrating the patient-level proportion of ESRD beneficiaries with a hospitalization claim in the same month. On the left side, in January 2010, 14.6% of patients had a claim for inpatient hospitalization. On the right side of the graph, in December 2013, 12.5% of patients had a hospitalization claim. So over this 3-year period, or 4-year period rather, there's a very gradual and steady decline in hospitalizations. Turning to the facility level graphic, this is the proportion of ESRD beneficiaries with a claim for hospitalization in the 6 months following. On this graph, the lines that are the circles that are connected correspond to the median facility. The diamonds just above them correspond to the mean facility. The upper and lower bars correspond to the 10th to 25th percentiles and the 75th to the 90th percentiles. And again, this is in relation to the facility proportion of patients with a hospitalization claim in 6 months. And again, on the left side of the graph, the mean facility had 42.6% of patients with a hospitalization claim in the next 6 months. And again, that slowly declined to July 2013, where 38.7% of patients in the mean facility had a hospitalization claim. Again, in July 2013, looking at the variation, the 10th and 90th percentiles of the distribution were 27.4% of patients and 50% of patients, respectively. Turning to transfusions at the patient level, again on the left side of the graph, in January 2010, 2.7% of patients had a claim for red blood cell transfusion in that month, and on the right side in December 2013, 3.1% of patients had a transfusion claim. The peak value was right around April 2012, 3.7% of patients. So although there was a brief increase in transfusions through 2011, it appears that the proportions are returning back to the 2010 baseline levels. At the facility level, again here, the circles connected by a line represent the median facility, corresponding to 50% of facilities having values above or below this number. In January 2010, 8.6% of patients in the mean facility had a transfusion in the next 6 months, and that has increased to 10.5% by July 2013. The median was very similar, increasing from 8.1% of patients in the median facility to 10% of patients in July 2013. The variation ranges the 10th and 90th percentile from 3.6% to 18.4%, July 2013. And that's about a 5-fold variation. Turning to the hypercalcemia measure, at the patient level, this is DPM data now, corresponding to serum total calcium. This is the 3-month rolling average. About 2/3 of patients have calcium levels between 8.4 and 9.5 milligrams per deciliter. That's in the yellow segment of the bars. That stayed fairly stable over time. In the dark blue segments at the very top of the graph, you see in general less than 3% of patients have a 3-month rolling average calcium greater than 10.2 milligrams per deciliter. Converting this to the facility level measure, again this is still DPM data, as you will see, the variation, because the number of patients with calcium above 10.2 is very small, the facility variation in the proportion of patients with calcium above 10.2 is also very small. On the left side of the graph, in August 2010, with 89 facilities, the mean number of patients in the mean proportion of patients in the facility declined from 2.9% down to 1.6% in April 2015, and the 95th percentile declined from 12.7% down to 5.8%, and that's the top of the error bars on the graph here. Single pool KTORV, this is also a measure on the star rating system, also part of the current QIP, the QIP. The patient level mean KTORV has fluctuated between 1.57 and 1.63. Currently in April 2015 it's at 1.6, so long-term trend is not very clear, but relative stability around 1.6. However, the proportion of patients with KTORV less than 1.2 has declined from 7 to 9% down to 4 to 6% in April 2015. And again, this is currently a measure that's associated with reimbursement, so there's been some action on the part of facilities to try and reduce the number of patients with KTORV less than 1.2. Like we saw with the hypercalcemia measure, KTORV at the facility level, proportion of patients less than 1.2. We see on the left side in August 2010, the mean facility had 7.6% of patients with KTORV less than 1.2, and that's declined to 4.9% in April 2015. The 75th percentile has declined from 11.1% down to 7%, and the 95th percentile has declined from 21.2% to 14.3%. Finally, looking at the vascular access measures, here again about 2/3 of patients are dialyzing with a fistula at the end of the month, that's the blue segment, and about 15% of patients are dialyzing with a catheter, the orange segment at the top of the graph. Looking at the variation by facility, proportion of patients using a fistula, there's more substantial variation here than what we saw for hypercalcemia and dialysis adequacy. The average levels have remained fairly stable over time. Both the mean and the median facility has 63 to 65% of patients dialyzing with a fistula. But the variation from the 5th to the 95th percentile in this graph ranges between 42 and 86% in April 2015. For more information, please visit the DPM website at www.dopps.org/DPM. We provide updates every 4 months, and our next update is going to happen in December 2015, and we'll have data through August of 2015. Also, we provide occasional updates to the American Journal of Kidney Diseases with many updates based on DPM trends that are ongoing. Thank you for listening.